From Alternate Advanced Bodywork. I'm a specialist in the treatment of chronic pain conditions and an advanced clinical massage therapist. And today I'm going to talk to you about rehabilitation exercises for chronic rotator cuff injury or chronic shoulder ligament injury, as long as the shoulder is not too unstable and prone to dislocating. People who should avoid these exercises: people with a condition called shoulder impingement syndrome, some of the exercises aren't suitable. People with frozen shoulder won't be able to do a lot of the exercises. And also, if you've had a past dislocation, check with a doctor or physiotherapist that it's okay to do these. Right. The first exercise we're going to do is an external rotation of the shoulder. So I'm basically going to use a TheraBand here, resistive latex tubing. You can get latex free if you're allergic to latex. And usually for a woman, usually you'd use a yellow TheraBand, which is light, or men a medium, which is red. If you're stronger, a woman might want to use a red, or a man might want to use a green, which is heavy, or blue, which is extra heavy. Okay, so I've tied this to a post here. You can, for this one, you can actually hold it at the other hip like so, and just do it like that. But you can't for some of the other exercises. So what I'm going to do is I'm going to keep my shoulder dropped down. I'm going to keep my elbow by my side. I'm going to start with my fist forward, like so. And all I'm going to do is twist out like that. So I'm bringing my knuckles round to the side, but without moving my shoulder. I don't want to be lifting my shoulder up. I don't want to be lifting my arm out. And keeping the elbow, shoulder still. Just simply twisting the arm out. Going to do 15 of these. Again, making sure I'm not using the body to do the movement. I'm just using the movement of the arm. Okay, you may want to start doing about 10 of those and build up to doing 15 or 20 if you're feeling strong. Okay, so we have a little rest between sets. Okay, so we'll do another 15. Okay, so that's 2 sets of external shoulder rotations. Next exercise, this is called Scapula, and is working the muscles that support the scapula, hold it against the rib cage. And what we're doing with this, we're wanting to bring the arm up. We're not bringing the arm up straight to the side. We're not bringing it up straight forward. We bring it up between the 2 planes, so bring it up at kind of 45 degrees that way. And while we do this exercise, what we're really trying to do is hold the scapula in against the rib cage and pull it down the back. So we're not just trying to do the movement without using these muscles here. I'm really trying to hold that in and pull that down. Get that movement pulling down to work those muscles. Okay, so we'll do 2 sets of this again, maybe 10 build to 20. I'll show you from the back. So I'm going to stand on the TheraBand just to pin it against the floor. Knuckles up. And again, I'm making sure that I don't use my body to do the movement. A lot of people will go, it's better to use, it's better to do the exercise correctly, to use the right muscles, and also don't use a band that's too heavy for you. It's better to use a lighter band and do the exercise properly than to try and use a heavy band and start compensating doing the exercise badly. So really trying to fix all that area while you do the movement. Okay, so we have a rest between sets. Remember putting that scapula down into your back pocket, fixing all this area here. What you don't want is all the joints and so on to be moving around in here as you do the exercise. You want to use the muscles to support them. Okay, so we'll do another set then. Okay, so 2 sets of 15 on that one. Okay, we're now going to do an internal rotation. So the previous exercise we were moving the knuckles out against resistance. This time we're going to be moving the knuckles in towards the belly. Thumb up on this one, and I'll have to turn around to use the resistance banding. So I'm going to hold it here, and again I'm going to bring it into my stomach, but keeping the elbow still, shoulder down, making sure you don't use the body to do the movement. You're just using the movement of the arm. If there's not enough resistance, you can stand a bit further away from the fixation point. Okay, I'm just going to do one set of those because the opposing muscles are usually weaker than these ones. Okay, flexion. So this time we're going to stand on the band again, and we're just going to knuckles upwards. I'm just going to move the arm up forward. So we're going straight forward with this one, but again, keeping the shoulder down and not using the body to make the movement. Not levering round. with any of these exercises, you're controlling the downward movement as the resistance comes off, as well as the lengthening of the band. You control the movement as the band shortens. Okay, we'll just do one of those. Going to do two of the next one. The next one is extension. So rather than moving the arm forward, we're moving it back just as far as is comfortable. You might want to have the band quite short to give you enough resistance for this one. So I'll step on the band a bit closer to my hand. Okay, so again, we're just moving the band straight back, but we're trying not to twist the body around or anything. Again, just moving the arm, keep the shoulder down. In a comfortable position. Got my thumb forward, and the knuckles are facing my hip. That's one set. Have a brief rest. You can have a longer rest, obviously, if you're not making a video. Okay, so I'll do that again. And making sure I'm not twisting round. Using the body to make movement and using the muscles in the shoulder to make movement. Okay, the last strengthening exercise is a scapular retraction. We're going to do this on both sides. And what I'm trying to do is, I'm trying to make a W with my arms like so. But while I do that, I'm trying to pull my shoulder blades into the back of my rib cage and down my back, so pull them down into my back pockets. So you're really working all those muscles, the back of the shoulders, around the shoulder blades, to pull the shoulder blades down. So I'll turn around, and we're just going to do 5 of these, holding them for 10 seconds each. So I'm pulling in and down. So in and down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is because the muscles that stabilise the scapula usually become loose and weak after a rotator cuff injury or a ligament injury. So pull the shoulder blades in towards the spine and down the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And while you're doing this exercise, try not to, when you pull the shoulder blades down your back, try not to push your belly forward. Try and do that movement without moving the belly forward. In and down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In and down. chest open, shoulders down. Okay, we're now going to do some stretches for the areas worked. First one is a chest stretch. Usually I'd use a door frame for this, and what you do is you put your arms on either side of the door frame and then you lean in like so. So if you imagine I'm leaning into a door frame, you can use a surface like this to do one side at a time. But anyway, so imagine I'm in a door frame, breath in, lean forward to lever the arms backwards. Stretch for 30 seconds. You can still stretch to use that stretch without a door frame, but it works better if you've got something against your arms. Okay, trapezius stretch. So these muscles often get problems if you've had a chronic rotator cuff injury. So I'm going to keep that shoulder down and back, and if we're doing the left shoulder, I'm going to take my head round to the right. So if you take a breath in, and you bring your head down, over to the right hand side. And again, holding for 30 seconds, kind of relax into the stretch, keeping that shoulder down and back. And it will take 20 or so seconds until the muscle starts to lengthen and release. And alter the position of your head slightly to get the tight areas. Okay, the rotator cuffs at the back of the shoulder now, infraspinatus and supraspinatus. So raise your arm up above your chest, and I'm pulling my arm in towards my chest and out that way. So breath in, and breathe out, pull the arm in and across. Try and feel the stretch in the back of the shoulder. Tricep stretch. So I'm popping this arm back and trying to put my hand pretty much on the back of my shoulder. It's better than having it central, it's better to have it over this way. So I'll hook my other arm behind my head, use it to lever this arm back. So breath in and breathe out. I'm trying to just push the arm straight back while trying to relax all the muscles in the shoulder. I'm trying to make sure I don't push my tummy out too much to take the stretch off the shoulder. As you feel the muscles start to lengthen, you can lean away from the stretched side to get a bit more stretch. Okay, stretch the lats now. So this stretch, what I'm going to do is I'm going to raise the hand at the side I'm stretching, and people often do the stretch wrong by just leaning straight over. It's really important to really reach up, and you're really reaching straight for the ceiling. And only when you start to feel that stretch round the side here and the back of the shoulder, then you lean slightly over to the right if you're stretching the left. But the main thing to do is to keep trying to reach the arm up towards the ceiling. gradually lean slightly more over as the muscle lengthens and releases. Okay, if you've got an acute rotator cuff injury, you want to rest it for the first couple of days. But you can do a lot of these movements without a resistance band, just to get the tissue moving as it heals, which is a good idea. You might not want to lift your arm up too high, but certainly a good idea to get it moving after the first couple of days. Right then, remember to see a doctor concerning any more serious medical problems or injuries. And remember that rehabilitation exercise alone often can't get rid of these problems. With a chronic rotator cuff injury, there's often all sorts of soft tissue issues that can be addressed with advanced clinical massage. Thanks for your time.